Isometric holds are the most effective knee pain solution that 90% of men over 40 have never tried correctly. Are you tired of modifying workouts, avoiding stairs, or waking up with stiff, aching knees? Every day you rely on temporary fixes like pain medications or knee braces. You're actually weakening the very muscles that should be supporting your joints. These 5 specific isometric positions, when performed with the precise technique I'll show you, can transform your knee health by creating a natural support system that gets stronger with age instead of weaker. Let's get right into these 5 game-changing isometric holds that can fix your knee pain forever. The first isometric hold targets the quadriceps while reestablishing the critical neuromuscular connection that most men over 40 have lost due to pain avoidance. Start by sitting on a chair with good posture. Extend your right leg until it's parallel to the floor but not locked. Now, without moving your leg, tense your quadriceps as if you're trying to push your kneecap up toward your hip. Hold this contraction for 30 seconds while breathing normally. You should feel tension in the front of your thigh, but no pain in your knee joint. What makes this so effective is that it strengthens the muscles without stressing the joint. As men over 40, our knee cartilage doesn't have a direct blood supply. It receives nutrients through movement and compression. This gentle activation feeds your cartilage without damaging it. For those with more severe knee pain, you can modify by not extending your leg fully. Even a 45-degree angle will be effective. This first hold is addressing one of the root causes of knee pain: muscle imbalance. As we age, certain muscles become dominant while others weaken, creating uneven forces across the knee joint. Our second isometric hold targets both the quadriceps and the often neglected vastus medialis oblique, VMO, which is critical for proper kneecap tracking. Stand with your back against a wall, feet shoulder width apart, and about 12 inches from the wall. Slide down until you feel a gentle engagement in your thighs. For most men over 40 with knee pain, this will be just a slight bend, nowhere near a full squat. The key is to find a position where you feel muscle engagement but no knee pain. Once there, hold this position for 30 seconds, while focusing on pushing your knees slightly outward, not allowing them to cave in. What most conventional approaches miss is that knee pain often stems from neuromuscular deactivation. Your brain actually turns down the signal strength to certain stabilizing muscles. This wall sit variation reactivates those dormant stabilizers. When you're in this position, you're not just strengthening muscles, you're retraining your brain to properly engage the stabilizers that prevent knee pain during everyday movements, like climbing stairs or getting up from a chair. For those with more significant knee issues, you can start with a higher position and gradually work lower as your strength improves. The third isometric hold targets the posterior chain, specifically the hamstrings, which are often weak in men with knee pain, creating a muscle imbalance that pulls the knee out of alignment. Stand facing a wall or counter for support if needed. Shift your weight to your left leg and position your right leg behind you, with the heel pressed into the floor and toes lifted. Without moving your leg, try to drag your heel towards you against the immovable floor. You'll feel your hamstring engage. Hold this contraction for 30 seconds while maintaining normal breathing. Research from the Journal of Strength and Conditioning shows that isometric contractions like this can reduce pain signals by up to 30% immediately after performance. That's why many men report immediate relief after performing these holds correctly. The beauty of this particular hold is that it rebalances the forces across your knee joint. Most men over 40 have overdeveloped quadriceps relative to their hamstrings, which pulls the kneecap into a position that creates wear and tear. This isometric hold helps restore that critical balance. The fourth isometric hold targets the inner thigh muscles and medial knee stabilizers that are often neglected in traditional exercise programs. Lie on your back with knees bent and feet flat on the floor. Place a pillow, ball, or rolled towel between your knees. Gently squeeze the object between your knees at about 70% of your maximum effort, enough to feel engagement, but not so much that you shake or hold your breath. Maintain this squeeze for 30 seconds. For an added challenge, you can lift your hips slightly off the ground while maintaining the squeeze, creating a mini bridge position. What makes this hold so effective for men over 40 is that it strengthens the adductors and medial knee stabilizers that prevent the knee from caving inward during movement, a common cause of pain and injury as we age. Unlike aggressive exercises that can aggravate knee pain, this gentle isometric approach creates strength without stress. It's specifically designed to work with your body's natural healing mechanisms rather than fighting against them. Our final isometric hold integrates all the previous work into a functional pattern that mimics real-world knee loading. Stand with your back against a wall for support. Place a small rolled towel under the heel of your affected leg, creating a slight elevation. Gently press your knee downward toward the floor without actually moving it. You're creating tension without motion. Hold this contraction for 30 seconds. This position teaches your knee to maintain stability in the critical last few degrees of extension, exactly where many men over 40 experience pain and instability during daily activities. What makes this fifth isometric hold so powerful is that it integrates all the neuromuscular patterns we've been developing with the previous holds. It's the culmination of the system, training your knee to function properly in a position that directly translates to walking, standing, and other everyday movements. For those with more significant knee issues, you can reduce the height of the towel, or even perform this seated with your heel on a small book or foam block. Now that you've learned each individual hold, let's put them together into a complete knee-fixing routine that you can perform daily. Here's your daily protocol for eliminating knee pain. Perform each of the 5 isometric holds in the exact sequence I've shown you. Hold each position for 30 seconds. Rest for 15 seconds between positions. Complete 2 rounds total, 10 total holds. Perform this routine once daily, preferably in the morning. The entire routine takes just under 8 minutes to complete, making it easy to fit into even the busiest schedule. For optimal results, consistency is far more important than intensity. A gentle daily practice will produce better results than an intense session once a week. As your knee health improves, you can progress by increasing hold times to 45 seconds, decreasing rest periods to 10 seconds, adding a third round for more advanced training. Most people report noticeable improvement within 7 to 10 days, with significant pain reduction by the 3-week mark. The key is performing these isometric holds with perfect form rather than rushing through them or adding unnecessary intensity. You've just discovered the 5 isometric holds that can potentially fix your knee pain forever by addressing the root causes that most traditional approaches miss completely. Unlike temporary fixes that mask symptoms, this system rebuilds your knee's natural support structure from the inside out, creating stability that actually improves with age rather than deteriorating. Drop a comment with your current knee pain level on a scale of 1 to 10 so I can track your progress as you implement these isometrics. I personally read and respond to comments from people who are committed to fixing their knee issues. Remember, these 5 isometric holds aren't just exercises. They're a complete system for rebuilding knee stability that's specifically designed for those over 40. I'll see you in the next video with more joint-friendly strength solutions.